All right, April, thank you so much. Speaking of monsoon storms, you know, we've had some pretty powerful monsoon storms the last few weeks, today included, and all that dust can cause some serious health problems, including valley fever. So here to talk more about the effects of valley fever and the symptoms we all need to look out for, Dr. Denise Worden from Arizona Naturopathic Medical Association. Dr. Worden, thanks for coming on the show with us.
Thank you.
And we were just talking as April was giving her forecast that today, unfortunately, is the right environment for valley fever.
It definitely is. Those little spores that grow in the ground are loving this rain and this heat. And then when this calms down and the winds come and it knocks it into the air, into our lungs, that's a perfect storm, so to speak.
So I've lived here many years, and I've always heard that if you live in Arizona for a good amount of time, you are likely to get valley fever. Is that true, number one? And number two, how do we protect ourselves?
Have a greater chance of getting it. 2/3 of all valley fever in the United States is here in Arizona, and 80% are in Maricopa County. So we've got a good chance of being exposed. So yes. And how do we protect ourselves? It's really about keeping your immune system up to speed so that we can mount a response to it, because probably we will be exposed. But if you're a runner or a walker and it's a dusty, windy day, not a great idea during this time of year. It's the late summer into fall that those spores are in the air and you're more likely to contract this.
Well, it's interesting you say that, because, you know, so often we love to be outside after a good desert rain, right? And so you're saying it's not the healthiest environment for us.
If it's dusty and windy, not great. If it's not, then probably okay. But if it's a bad day as far as dust and wind, and you're going to be inhaling those, we're more at risk.
Okay, so Dr. Worden, talk to me about the symptoms we're looking at, and how do you tell when it's valley fever and you need to go get treatment versus just, say, a typical flu?
You really don't, and that's the tricky part. There are a lot of misdiagnoses and undiagnosed valley fever cases. They look like, feel like colds, flus, and other viruses that we have going on right now. Chills, fever, shortness of breath, fatigue, looks like, feels like. So asking your doctor, you know, you're being tested for other things right now, bacteria and viruses, but we should also be testing for fungal, this coccidioidomycosis, right? And that's why we go to medical school, right? Coccidioidomycosis is to be able to pronounce that. But is that we really should be testing more for this. It's misdiagnosed and missed many times, and it can cause long-lasting problems.
And I guess that would lead to the next question is why is it so important to pinpoint specifically that it's valley fever?
Right. An antibacterial and antibiotics not going to help you. An antiviral, this is a fungal disease. And it requires measures to help mitigate the replication of a fungal. It's different.
And how is it different? So how do you treat it?
So the only recognized way is antifungal medications, but they too are not foolproof. They only try to stop the replication. They don't necessarily eradicate it. So you have a chance of reinfection or, you know, getting it again if you haven't taken care of your immune system. That's the last line to fight. Our antifungals do the first piece.
Can you help us understand why some of us get it and it's like a cold, and there are some folks who have very severe, long-lasting symptoms? What is it that differentiates those two patients?
Right. It really does come down to the immune system again. And there are certain populations that we know, especially with valley fever, non-Caucasians are more at risk. And it doesn't have to do with skin color, it has to do with genetics. We need to be looking at the genetics, figuring this out like we are with other pathologies going on in our day and age, to say what are the genetic differences and how can we help protect.
Okay, you say boost the immune system. What if you could give us 2 or 3 quick things that we can do to best bolster our immune system? What would you say that is?
Decrease sugar.
I know
that it really does a tap dance on our immune system. Decrease sugar, decrease stress, or handle it the best that we can, find measures to help with stress, and eat better, exercise, all the basics. Eat more vegetables, less sugar, exercise, and handle your stress. That's the best.
The solution is so simple and so complicated all at the same time.
It's right. Simple and not easy, though, right?
Yeah.
To say, let's cut out the bad things.
Absolutely.
But it really does make a difference. Our best fighters is our own immune system. The fever that we produce is the first line against most of these things.
Sure.
But the problem with the fungus right now is that it's learning to grow in hotter temperatures, like here in Arizona.
Yeah.
Those temperatures are similar to our internal body temperatures.
Okay.
So guess what? Our immune system, our fever, can't work as well as it used to against valley fever.
Well, Dr. Worden, important conversation. Thanks for taking the time to talk to us about it.
Thank you.